Alan's a former actor who's struggled with opioid addiction. Today, he's 7 months clean with the help of methadone and counselling.
But people, have that thing like, oh, methadone. No, they're new drugs now. Like methadone it has a stigma over it.
The best tool for managing recovery, for addressing people who are in active drug use and therefore at greatest risk of overdose that we have is what's talked about as medication-assisted treatment, the selection of FDA-approved medications which substitute for or can be used to step down from particularly opioid addiction. That means methadone, buprenorphine, naltrexone. If you're not on methadone, your chances can get as bad as 90% of relapsing.
After witnessing the drug crisis, I'm struck by the unprecedented potency of the Chinese and Mexican-made synthetic opioids flooding the US market. They're also exceptionally easy to acquire, so easy that it takes virtually no time to find on the streets of New York and Philadelphia, and the internet brings this crisis to small-town America as well. This crisis spares no social class. It's everyone's problem, as seen in the case of a young professional like Julia Gaharamani. The widespread fentanyl epidemic now sees New Yorkers carrying Narcan for emergency revivals. It seems to me that there are a couple of options to deal with this crisis. At one end is the zero-tolerance approach. This assumes strict drug laws, but also rigorous enforcement, which is something that is demonstrably not happening. The second way forward is a safe use approach. Some campaigners say that addicts need to have autonomy over their lives. But do any of them actually have any control over their own lives? I'd say not. They're slaves to ever harder drugs. Perhaps, as well as acceptance, some degree of stigma and accountability, like mandated treatment and drug courts, is also necessary to help them out of something that shouldn't be a lifestyle. The reality is that we've all known the drug crisis is happening. And yet, America has allowed it. The question now is whether it should.